We're going to be talking today about three things every physician needs to know about their patients who use cannabis. I'm going to pop up on my PowerPoint presentation here, even. And so, at, let's just get into things, shall we? Your patients are using cannabis, whether you ask them or not. A lot of times, maybe we're scared to ask. We don't want to know. It's like it's cannabis, or maybe we ask, but your patients are going to be scared to answer because they're afraid you're going to finger wag at them, and say, "Oh, don't use it." And so there's a lot of concern and fear about what we can do. But the most important thing is your patients are using cannabis, whether you ask them or not. So that's why we need to have this conversation. I'm Dr. Janice Makala. I'm a physician with over 20 years' experience, board certified in geriatric medicine, hospice medicine, palliative care, and internal medicine. I'm also a practicing hospice medical director of a small hospice in Chicago. I'm the host of Q&A with Dr. Makala, and I'm your guide today to physicians learning about the endocannabinoid system in cannabis. So, more people than ever are using cannabis. That's the first fact to know. The number of people using cannabis is growing. The prevalence has increased significantly just in several years, from 2013 to 2021. In adults 19 to 55, it's gone from the people who have used cannabis in 12 months, it's gone from 22 to 34%. And any use in the last 30 days, so in the last month, that's gone from 13 to 22%. And daily use, people who use it every single day, has gone up to 8.6%, up from 4.8. So we are seeing numbers almost double in terms of percentages of people using cannabis. The medical use was reported by about 2.6% in all groups 18 to 65. And we'll come to that because notice that's not the geriatric population. In fact, data shows that the older people tend to use cannabis more than medically than recreationally. So the other thing is cannabis is more accessible than ever. 41 states plus DC and Puerto Rico have legal cannabis. 24 states have recreational cannabis. And then, of course, if you're familiar with the Farm Bill in 2018, that allowed hemp-derived cannabis products such as CBD, but then also hemp-based THC and even Delta 8 to become federally legal, which means people in states where you can't get it, you can still buy these products. And you can buy these online. And then, in addition to that, you now have the hemp based beverage industry. And so the beverage industry is backed a lot by big alcohol, which is seen an opportunity. So more and more liquor stores are starting to sell um, THC beverages in them. In addition to the United States, 57 countries, because of course it's not legal federally in the United States, 57 countries have some form of legal cannabis. So lots of people are using. What's more, I mentioned how that last data was on younger patients. Older people, many more older people are using cannabis. 7% of all people over 65 admitted to using cannabis in the last month. Cannabis use by elderly has gone up 46% in just 2 years, between 2021 and 2023. The demographics are changing. We're seeing a lot more of different demographics, and particularly populations that wouldn't have admitted to using if they were using, such as highly educated, richer white consumers, women, all these populations where they, you probably had some people using, but they weren't telling people about it, are now more open and talking about it publicly. More people with more complex medical conditions are using cannabis. as we get this geriatric population, a lot of them are using it for medical reasons. And because they're using it for medical reasons, they're going to have medical issues that go along with that. And that can be a concern because, they're trying to treat something, but now they have 10 other diseases that are being treated by the doctor. Second point, even if cannabis never existed, our body would still have an endocannabinoid system. And you may say, what's an endocannabinoid system? Well, it was discovered in the 1990s. That's part of the reason a lot of doctors don't know about it. I mean, I graduated from med school in the late 90s, and I think a lot of doctors who have graduated, who are a little bit older, like myself, have didn't even exist when we were being taught, or it was just barely existing. What's more, it's still not making it into the medical school curriculums, partially because it's so early, and partially because I think the name kind of scares people a little. But the ECS is a system that maintains physiologic homeostasis throughout our body. It is a master of all of our different systems. There are two main endocannabinoids, anandamide, AEA, and then 2AG. There are two main receptors that they activate on, CB1 and CB2. There are other receptors throughout the body, including, interestingly enough, the hot pepper receptor, TRPV1, the thing that makes hot peppers hot, um, that plays a role in modulating this system. There's a whole bunch of other receptors. Now, where is the ECS in our body? Well, it's almost everywhere. The CB1 has brain, spine, fat, liver, GI tract, heart, endothelium of the vasculature, reproductive organs, kidney. In addition, it's in our immune system, our spleen, lymph nodes. It's in fat cells. And as we mentioned, pancreas cells, bone, heart, liver. It is everywhere. It is it is very ubiquitous. Yeah, I'm going to throw a question, and I realized I don't actually have a. Let me see if I got any questions. Yes, okay. If you guys can throw it in the comments, I'm going to ask this question here. What is the most commonly used pain medication that activates the endocannabinoid system? Now, we have a little bit of a lag, as I mentioned, unfortunately. So I'm not sure. Normally, I would ask you to throw in the answer. But I think I'm just going to have to give it to you here. But the most common used pain medication that activates the ECS, a couple little hints. It's not opioids, and it's not cannabis. Yeah. So the most common used pain medicine that activates the ECS. Ready? Tylenol, acetaminophen. It actually works in the inhibitory pain pathway and activates the CB1 receptor in the brain to block pain. It probably works at fever the same way too, through the endocannabinoid. And further, there's some new study to suggest it might even affect the 2AG to increase that in your system. So there's a few different things that Tylenol actually does. Acetaminophen, was one drug, but then the other ibuprofen actually also doesn't directly affect the ECS, but the COX-2 and the ECS, those two systems have a lot of talk back with each other. So the ECS is really part of pain. Yeah, Tom, you got it. Tylenol. Exactly. So let me go to the next one, another quiz. What regularly consumed substance directly impacts the ECS? So, again, a little bit of a lag here, but I'll try to give us some clues in the meantime. So, what regularly consumed substance? No, okay. I purposely said substance just because if I said food, You might, and it's not really a food, it's, something in food. It's not a specific food, but it's, um yes, it's a family of things that we eat. So, that, believe it or not, and like I said, I may have thrown that a little bit off. Unsaturated fatty acids. In fact, that's probably one of its biggest things. Omega 3, omega 6, and omega 9. Omega 6 is actually a precursor to the endocannabinoids of AEA and 2AG. And omega 3 and omega 9 modulate the ECS. What that means is that these these three fatty acids, which are, well, 3 and 6 are essential, 9 our body can make some, work on our ECS to help balance it and help maintain, and it's probably part of the reason omega 3 is so important for us. Caffeine is caffeine. That was a good guess, but no, it's the omega 3s there. So we'll go on here. Now, the second thing, third point, not a cannabis is an actual medication. Much like, and I'm going to make a case just like you might see in a commercial for a big pharma drug. What do you see in that, right? First, let's just be clear. There is actually FDA approved cannabinoids. Dronabinol is synthetic THC. It is FDA approved synthetic THC. It was created synthetically in a lab by the pharmacy to get around the DEA Schedule 1 issues. But chemically, it is identical to THC. And it's approved for chemotherapy induced nausea and approved for HIV induced anorexia. Now, then the other FDA approved cannabinoid we have is prescription uh, cannabidiol. I never say that quite right, but CBD. It's actually derived from the plant, from the cannabis plant. And that has been approved for seizures associated with a variety of different severe pediatric conditions. The So, yeah, first of all, there's that. Now, the other thing is, how does cannabis affect our body? If it's a drug, it's going to do something and what it does is the THC acts directly on the CB1 and CB2 receptors. Of course, that causes the sensation of being high, but it also is what's responsible for a lot of its medicinal effects. CBD also modulates the endocannabinoid system. It doesn't act directly on the CB1, CB2 receptors, and that's why people don't get a high with CBD, because it doesn't. It rather modulates it a little bit and affects the binding and what of THC and the endocannabinoids. Cannabis can have drug interactions. It affects the metabolism of other drugs. Cytokine P450 is the enzyme in the liver that helps us process a lot of different drugs. There's quite a number of drugs that use those. And so when you take a drug that works by that or activates it, it can interfere with the breakdown or it might hasten the breakdown of other drugs. So, again, another thing you need to know is cannabis can interact with people's meds. A couple notable ones are tacrolimus and warfarin, because those are extremely, bad meds to be too high or too low. So you want to be careful with those, right? Because you don't want too much tacrolimus or too little. Same thing with warfarin. So now, it can also increase or decrease the physiologic effects of other drugs. One of them is the blood pressure pills, because if your blood pressure is either super low, because maybe you have a bad heart and your doctor is getting your heart, low, your blood pressure low to keep for that case, or you have a very brittle high blood pressure, both of those might react badly to cannabis, because some people, their pressures go up high, especially if they're smoking it. But some people also can get hypotension with cannabis. So you got to be careful about that with other meds, that it can might affect the physiologic effect of other drugs. Cannabis can have adverse effects on people, obviously. So as a doctor, you got to monitor. Okay, you're using cannabis for this and that and whatnot, but is it developing dependence? Are you getting psychosis, especially in younger adults? Most states have a cutoff of 21, but some people can even get psychosis in their young 20s from cannabis. Cannabis hyperemesis syndrome, something we can talk about more if you have questions about it. Chronic bronchitis, particularly if it's smoked. Dizziness, lethargy, confusion, falls, especially in people who are frail or elderly. And of course, there's been a lot of stuff in the news about the possibility of whether chronic use can cause heart disease or not. Now, there are some people who should not use cannabis. People with schizophrenia, bipolar, psychosis, adolescents, definitely, and there's some good reasons for that. People who are pregnant and nursing. Um, Caution in frail elderly patients, of course. There's been a lot of talk about using it for Alzheimer's and some other conditions like this, but elderly patients at risk of falls, got to be careful about that. Caution in patients with people with substance use disorder. And I have a little asterisk there because there's a lot of data to suggest that people with opioid use disorder might actually be able to come off of their opioids or decrease their opioids if they start using cannabis. That cannabis can help people taper off. That data is still ongoing, but it's very interesting data about that. So, these are just a few examples of how cannabis is a very complex. It's highly individualized, which is why it's so important to have a deeper understanding when guiding patients in these conversations. It's important to know how cannabis affects your patients and your practice. So, that's my three things that every doctor needs to know about cannabis. I'm in the process of creating an educational program for physicians about the ECS, cannabis, and patient care. And I want to ensure that what I say is, and I want to ensure that what I'm presenting is truly valuable and high yield. So I'm actually asking for your help. If you really found this interesting and you're like, oh, that was cool, I need your help. I need your input to determine what topics matter the most to physicians and how you prefer to learn. I'm asking a limited number of physicians to meet me, brief video, no longer than 30 minutes, possibly even less, to answer just a few questions and share their perspectives. I want to find out what's important to you, what you want to learn, how you want to learn it. As I create this program, I want to make something that's very useful and very helpful. Uh, you can message me, even if you just message the word talk, I'll reach out to you and we can connect. So that's my big ask. But I hope you guys all had a very great, enjoyable discussion. Again, little brief thing. I am going to wait on here for questions a little bit. I know the let me get, if you have any questions about anything, I'll be here for a few minutes here. Because again, besides the lag, just, you might think of something. So, but I hope everyone enjoyed themselves and is having a good evening. Okay, let me just see real quick. Thank you again so much. Ah, excellent. So, thank you guys again so much. Oh, good, Linda. I'm glad you enjoyed this. Yes. The Thank you. We had some pain management docs from Florida talking to our addiction conference about that. Right? It's really fascinating. There's been some big population studies to show that in states, they actually one of them did a very interesting where they looked at the registry because a lot of states have registries where if you're on opioids, the doctor has to submit it to the registry. It's to keep people from doctor shopping and getting their opioids from multiple doctors. And so they went on the registry, and in this particular state, the registry also had to list if the patient had medical cannabis card. And they found that the amount of cannabis that once people got the cannabis card, the amount of opioids that the doctor needed to prescribe to them decreased. And that's just a little geeky um, thing about that. And it says, yes, we're having the same feedback about 5-to-1 ratio of CBD THC, right? Yeah, there's some really interesting things about its role with addiction. But of course, it's not FDA approved, but I hope I made a good case here that really it's a medicine and it should be treated like a medicine, not some, you know, some woo woo whatever, right? So, thank you. I'm glad everyone enjoyed themselves. I am going to cut off now. I apologize if anyone has any last minute questions that they throw in right before the leg. If they do, I'll try to get back to you in person. And I look forward to talking to everyone. You all have a great evening and take care. Okay, I can. A little issue with the mouse. There we go.